Hello, good afternoon, and welcome to today's edition of the Afternoon Edition. My name is Isa Lu. Today we shall be focusing on issues that matters to health, and most especially when the United Nations do set date to recognize such day with respect to how we do with our things on health. Definitely, you know that day is very, very important. But then today is the World Stroke Day. For many, you understand when they say stroke, this time around not cane, but in the medical field, when we say stroke, it means like a shock. And that is how many of us grew up to know about people falling into this particular condition. Now, for many of us who grew up in the midst of elderly people, we must have heard of one or two cases of elderly people who actually have this issue of either full stroke or partial stroke. And then so many concerns on how we can remedy or how we can help in this particular condition. And that's the more reason why every year the United Nations do set a date aside to see that yes, we create more enlightenment on issues that borders on stroke. But today with me in the studio is Dr. Ada Ume, who is here to actually tell us more about this specialty. And because she's a cardiologist, she'll be able to give us answers to some of the question, or even all of the question today on the program. So we'll go on a very short break. But before we go on this short break, have you had any condition where somebody said he has someone who is undergoing treatment with respect to stroke? Or yourself, do you actually have this same condition? Now is an opportunity for you to also learn on how you can prevent this particular issue in your family and in our community. Let's go on this short break, and when we resume, we continue with this conversation.
We are a nation blessed with people of diverse cultures, religions, languages, and opinions. It is ironic that we are now being ripped apart by our greatest strength, our diversity. We have allowed intolerance, insensitivity, bigotry, and nepotism to blind our vision of the greatness we can achieve working together as one. We may not have the same culture, nor religion, nor language, but we all belong to the same nation by the divine will of God. We did not choose to be Nigerians. Nigeria chose us. This nation is our divine heritage, and if we open our eyes, we would realize that what divides us pales in comparison to what unites us. And by the comparison and conciliation of our differences, we will grow until our differences disappear. Our unity cannot be willed by mere declarations, nor do we get unity by ignoring the questions that beg for answers. We must celebrate our diversity and debate our differences without fracturing our unity. Our strength is not in our numbers, but in our unity, because even the weak become strong when united. Nigeria unite.
This message is brought to you by Abuja Broadcasting Corporation, owners and operators of ASO Radio 93.5 FM Abuja, ASO Television DSTV Channel 392, Star Times Terrestrial Channel 127, Free TV Channel 507, People's TV Channel 285, and UHF Channel 38.
Welcome back from that mild break, and just before the break, I did inform you that today is the World Stroke Day with a theme, Greater Than Stroke, Active Challenge. And this theme may not be so, it may be vague to so many persons, but those in the field will definitely know what it actually means. For myself, I won't go into the details based on the little I've read or I've researched on, but that's the reason why we have someone in that field to tell us how important this day is and why does she think that they are making use of this particular theme to address the issue of the World Stroke Day this year. So, good afternoon, Madam or Dr. Ada Ume. It's nice having you on the program.
Thank you very much. Good afternoon.
It's been a while I've addressed issues on health, and today is the World Stroke Day. You are here as a cardiologist. What is it about stroke? We've heard it in our community, seeing people falling sick. So person will just be standing and then before you know, they just fall. Sometimes you hear that there's a partial stroke, there's a full stroke. So tell us, give us an understanding of this World Stroke Day and how important is it for people to actually know about stroke.
Thank you so much. I think this World Stroke Day, we're working towards preventing stroke. That's the aim of the team. Basically how we can use sports, how being active can help to prevent stroke. And this is important because a lot of people have sudden instances where family members, loved ones will just develop stroke, inability to move part of their body or something like that, and it's usually a tough time for them. But stroke in simple terms is just when there is a reduce in blood supply or interruption in blood supply to the brain. And you know, this can be for a short time, this can be for a longer time, but by the time blood is not able to get to certain parts of your brain, it causes, especially for a longer time, it causes the brain cells around that area to die. And so depends on the area where this blood supply is cut off, that's what kind of symptoms you would notice in these individuals. And then and our work towards World Stroke Day is to create awareness to people, because for stroke, the thing about stroke is how fast you can detect it. So you have a lot of people who have their loved ones who started showing symptoms here and there, but they couldn't tell first or fast that it was stroke, and so they delayed with going to the hospital, especially in this part of the world where we don't really want to go to the hospital first. There's solutions like prayers and home medications and local medications and things like that, but the aim of stroke is that the faster you detect it, the faster the management, the better the result. So one of the things we watch out for stroke is time. Time is of essence with finding out stroke, and so that's why there's this awareness about it. That's why we try our best to go out and speak about World Stroke Day, how to prevent it in the first place, how to find out when you are having the symptoms, and how to treat it urgently.
Okay, that's very good. Giving us a basic understanding of what it is, and I'm happy that you were able to explain in detail how it actually starts. And then for so many, is it possible that regular physical activity impacts stroke prevention?
So yes, especially with exercise. So when we say regular physical activity, we mean at least being active. You know, a lot of people have the sedentary lifestyle. A lot of us work in places where we have to sit down for hours upon hours, and then from there we head home and eat and sleep. You know, that's what we call the sedentary lifestyle. And being active, we are trying to say take walks. You know, as little as 30 minutes walk, as little as jogging, or if you have the ability to go to the gym. Basically being active, exercising would help prevent stroke, because one of the largest, especially in this part of the world, risk factors for stroke is hypertension. So being active helps reduce the risk for getting hypertension, and therefore impacting the risk for stroke in the first place. So the ability, and apart from reducing hypertension, it also helps with especially those people who are overweight or obese, because obesity as well is one of the risk factors for getting stroke. So being active would help reduce a lot of risk factors that leads to stroke and, you know, some other diseases related to stroke.
So invariably those who are obese, definitely there's that high chance of them having stroke. Yes,
because you know, when people who are obese and on the big side, they have most of them have ability to create or to make something we call atherosclerosis. Basically, they have higher cholesterol levels, and therefore causing there to be plaques in your blood vessels, obstructing blood flow to certain areas, and this can be in the brain. So those people who are obese also have a higher chance of having blood pressure, high blood pressure, and so weight loss would go a long way in reducing their risks for certain diseases like hyperlipidemia, hypertension, and therefore reducing their risks for stroke. Also even diabetes, because most people who are obese have a higher chance of getting high blood sugar. That's what we call diabetes, and then therefore leading to, these are the things that predisposes one to stroke. Those people who have these diseases have a higher chance of developing stroke in the long run.
So in this particular regard, most especially here in Nigeria, where we still have so many gaps to fill in the health sector and also in our herbal medical practice, you discover that at some point somebody will just say, oh, my dad was sleeping, but at the end of the day, there was nothing last night. But we woke up and saw that he couldn't actually move part of his body. Is it that you mustn't be doing something and then it can just come up?
Yes. So there are different types of strokes. There are two major types of strokes. So there's a stroke where there is bleeding in the brain, and then those people have those symptoms, and there is some where there is a blockage. So actually, most people have their strokes, especially most common one in this part of the world, silently. Basically, they would not be actively doing anything, and the most common cause of that one is the blockage. And yes, it can be seen in any kind of people, because mostly, especially with even age, is one of the risk factors for getting stroke. So as you advance in age, you're at more risk for having stroke. And then most people, when they're advancing in age, especially in this part of the world where they feel like the medical system is not up to par, most people try to stay away from going to hospital. They see it as a point of testimony, like, I haven't been to the hospital for so amount of years, you know. And I somehow disagree with that, because I believe very well in checkups. So if you're having going to the hospital for frequent checkup, it doesn't have to be a specific problem, you know, going to check my blood pressure, my sugar, the important things, my cholesterol level. If you're doing that, you'll be able to point out these things before it advances to stroke. So most of the time when people find out that their loved ones just slept and woke up and a certain part of their body is not moving, or they can't walk as they used to, or they can't talk as they used to, most of the times is because there was something hidden. There's been an yes, exactly. So there's been something, maybe a medical condition that hasn't been noticed, haven't been diagnosed, or have been neglected for a while, and so that triggered, or that was one of the things that precipitated the stroke, and then the symptoms is what they're beginning to see. So it's not like, oh, my mother was just good and fine, and all of a sudden something must have led to it.
Okay, in this regard, so what specific exercise or types of physical activity are most beneficial in reducing stroke?
So basically, we want to go for anything that would keep you active, basically. So I know that recently there are like a lot of people then include yoga and stuff like that to exercise. That's good for your mental health, but we want active. So anything that would require you to move, you know, to run, jog, walk.
Not using technology this time, like your car. Or
no. So
well, I have a bicycle.
No, so you can, you know, with bicycle it's better.
It's better, yeah.
Because exactly, with bicycle you're actively moving. With your car, especially with automatic these days, your leg is just at one spot and you're moving, and that's it. But with active, we're trying to make sure that your body is moving, you're actively losing calories. So let it be that you're walking, you're riding, you're lifting weights, you're jogging, you're running, whatever it may look like for you, but the aim is being active, because once you're active you lose calories, and we would always prefer those exercises that will make you lose more calories. So what I usually tell my patient most of the time is, you know, take a walk for 30 minutes. In between the 30 minutes, let 10 minutes be jogging. Every day, 30 minutes a day. That's all we're asking for. Use 10 minutes out of the 10. So you could start with a 10 minutes walk, a 10 minutes jog, a 10 minutes walk. And that's it, every day. It's good. That's the exercise requirements to help reduce blood pressure and other things related to stroke. 30 minutes a day for exercise
is enough.
Yes.
Okay, but at what point will one now say, oh, I'm having this, I'm having that, apart from going for medical checkup before? Because some people, you know, due to activities, they may not have that frequency of visiting the hospital. But then, when there are signs, at what point will one say, okay, I'm suspecting something, so let me go to the hospital?
Yes, so there are signs. There's something we use in the medical term, and I'll try to make it as simple as possible. We use an acronym called BEFAST. BEFAST is so that you can remember to be fast, and the acronym helps you remember. So B is for balance. So when you notice your loved one is having maybe dizziness, not coordinating well, cannot walk as they used to, basically not finding your balance, that's a trigger sign. And then the E is basically for the eyes. So if your loved one is complaining of blurry vision, sudden blurry vision, sudden difficulty in seeing in one or both eyes, those are one of the trigger signs. And then the F is for face. So you ask them to smile. If you notice there is a drooping and one side of the face is falling down from the opposite side, those are one of the signs as well. Especially if maybe they are unable to close one eye, or one eye is looking closed, the other one is open, those are the things to look out for on the face. And then we have A, which is for the arm. Most stroke or types of stroke actually affect weaknesses in different parts of the body, so we just use arm for the acronym. Well, basically there's weakness on one side of the body. Maybe you could ask him or her to raise their hands and you notice that one hand cannot stand or remain against gravity. Those are one of the signs. And then the S is for basically you ask them to talk to you. So if you notice that they are not speaking like they used to, it's basically for speech. So if they're not speaking like they used to, or their speech is slurred sort of, or you notice that they cannot find the right words, suddenly someone who speaks to you normally can no longer speak to you the way they used to, cannot find the right words to express themselves, or having problem comprehending. Those are the things. And then T is time. So I told you the aim of the acronym is so that you can know to be fast. From the first time you notice the symptoms on yourself or your loved ones, you note the time, so that when you get to the hospital you can let your doctor know, because time is of essence in treating and management of stroke.
Okay, in this particular regards now, for instance, somebody have actually understood everything you stated, and it happens that you are in a rural setting where some of these facilities may not be there, and you started noticing issues that you just raised now, and you discover that it just happened. Are there any immediate attention that one can actually give to such person?
Unfortunately, as regards to stroke, you need to go to the closest hospital as soon as you can, because for stroke, the first thing is for us to know what kind of stroke are we dealing with. So we can't tell you this is what you should do and what you should not do regarding your loved one. The best thing to do for your loved ones if you're in a rural area and this happens is to look for the closest hospital you can get, because the first step to management of stroke is getting a scan done. So your doctor is of course going to examine you, but we have to know what kind of stroke are we dealing with, because our next step of management is usually dependent on what type of stroke. And the problem is that with the two different types of stroke, if you manage interchangeably, you could affect the other one. So basically, for the bleeding stroke, which we call hemorrhagic stroke, the management is different from the ischemic stroke. And so for the ischemic stroke, where there is reduction in the blood supply to that area of the brain, if you manage it like hemorrhagic stroke, you can cause more bleeding. So these are the issues. There is no home treatment or home therapy to stroke. You need to find the closest facility to you as soon as possible, because the fastest and the earliest you get to a facility and begin treatment, the better the outcome for stroke.
Okay, because some people, when they have stroke, you see they give them local care. Sometimes we look for those men down there, and then they say, "Oh, Baba, please come and be massaging his hand," and all those stuff like that. Does that actually help?
Actually, it does more harm than good, actually, because I've had patients where they came in with sores around their bodies and stuff like that. What happened? They got stroke in the village. They took them to this herbalist who started putting certain hot things on that area and massaging it in certain areas, and just worsening the entire thing. First of all, the stroke is still there. Secondly, you have more problems to add to the stroke. So most of these local things, however good that they may seem like, harmless, most of them actually worsen the situation. In fact, the more you wait for those massages and whatnot, the problem is happening in the brain. No matter how much, so imagine that you have a problem and you're dealing with the symptoms of the problem without actually dealing with what's causing the problem. So no matter how much you massage that arm, it doesn't stop what's happening in the brain, except you can't massage the brain.
Indeed, you can massage the brain. So how much, what role does diet actually play in stroke prevention, especially when combined with an active lifestyle?
Yeah, diet is also very important. It's one of the things we advise our patients on, especially with regards to the things that predispose you to stroke. With diet, we're looking forward to reduce salt intake, especially this part of the world where everything we're eating, everything we're eating has some salt in it. Not some, a lot of salt in it. But being intentional about salt intake, I believe that every person, especially around here, even worldwide, once you get to the certain age of 60 thereabout, you should be having minimal salt in your diet. We're trying to reduce salt intake, reduce oil intake, too much fatty foods. These are the things we're trying to prevent, because with reduction in these certain meals and good diet, you'll be able to reduce certain causes of stroke. So you'll be able to reduce the hypertension, the diabetes, you know, the hypercholesterol and all these things. So especially with as regards to the kind of food you're eating, basically, because now here we have our foods are most likely rice, yam and things like that. And so a lot of people, just because that's what they can afford, if we can reduce our carbohydrate intake and increase that of proteins and vegetables, I'm not saying we should cut out I said reduce, you know, that would be able to go so far for us, especially as regards to our diet.
Okay, that's very, because but then that aspect where you say reduce salt, you know, we love taste, and you can't just go and eat and like me, if you give me food and I don't feel that sense of a bit of salt in it, it's very difficult for me, because the moment I finish eating that, I'll be craving for another. But then still, that's a very good medical advice. And for people who have suffered stroke, what are the best ways to safely incorporate physical activity into their recovery process?
Oh, sure. For people who have suffered stroke, we highly recommend physiotherapy. Why physiotherapy is important? It encompasses, you know, both physical therapy, speech therapy, occupational therapy. So these basically helps with recovery. Most of the recovery after a person has stroke is within the first 6 to 18 months. And so during this time, usually the physiotherapy usually involves helping them recover their balance, their walk, their speech, you know, their coordination, basically trying to help you get as close as possible to the way you were before. It takes time, but it's very essential. Especially, you know, some people say I can, my brother can massage me, my sister can massage me at home. I understand, but you know, there are people who are trained to do these things, and there are certain ways they can help you, and then you'd see more progress as to just, it's not just massage. Basically, they're helping you take your steps again. They know how to the amount of steps you should do, or amount of work you should put in each day to be able to achieve certain things. So most hospitals would offer physiotherapy. Most people would decline, especially because of cost, and we understand how the situation of the country is. But with these exercises and this therapy, it goes a long way in improving your outcome. Because as I mentioned earlier, the 6 to 18 months is a very crucial time. Most of the improvement you'd make is within this time. So you put in as much effort, because you know, imagine losing your steps and all of a sudden you are beginning to learn how to walk again like a child. So it can be very emotionally draining, and this is what the physiotherapy really encompasses, both occupational, speech, physical, mental, just basically getting you back to your feet, and you know that I can stand again on both feet. So it goes a long way. It's really very important in the recovery for stroke.
I've seen many situations where people actually who are actually patients in this particular with this particular kind of issue, traveling outside Nigeria to get treatment. And the worst is when you see them going to Ghana, or probably South Africa or Egypt. For this, is it that we don't have enough professionals to deal with issues like this? And unfortunately, when they go out there, it is still the same Nigerians like you that they meet out there.
That's true. And that's very, very funny, because I personally, and especially currently at CardioCare where I'm working, our aim is to reduce medical tourism. And I think that we've gone so far in doing that. There are a lot of procedures that are not done in certain areas in Africa that is being done at CardioCare Hospital. And this is not to just say at CardioCare, but I believe that we don't value our own, you know. If I was to go to these countries, let's say Togo, I migrated to Togo to practice medicine, and I'm just doing exactly the same thing I'm doing here at CardioCare, and I charge double of it. A lot of people would rather come and meet me at Togo than, you know, do it here. And it tells a lot about our mindset. You know, the aim of traveling to certain countries to receive healthcare has been defeated, especially because there are a lot of hospitals now that are doing everything and anything that you can go and get in any part of the world at the same with the same grade. So it's not like you're saying this is substandard. We give the best care the same way you go to any part of the world and receive the best care there. And something about traveling to receive medical treatment tells a lot about what you think about your country. Especially, you don't see people coming from that part of the world to come here to receive medical treatment. So the question still boils down to, what are you actually looking for? Because if you're looking for great healthcare, you're looking for great service, and you're looking for not, you're making sure that, okay, because there's this thing about Nigerians making mistake. The funny part is that there's still, wherever you go to, you still meet the same Nigerians there. So whatever you're looking for, we have it here. There is a place here for you that is trying to that can give you that same care. And that's why I mentioned earlier, that's why at Cardiocare our aim and one of our missions is to reduce medical tourism. Whatever you're looking for outside, come to Cardiocare. We'll be able to give you the same care, and even up to par, even more than you'll be able to get outside.
Well, that's very good. I'm happy you're stating this very clearly, because we've had series of cases, even for the simplest of it all. You see people actually do travel out just to get something that they say what you think is in Sokoto is actually in your sugar.
Yeah, exactly.
But let us move forward to other aspects of this. And one particular aspect that is very, very troubling is that in the past we used to hear, or we do see, it actually happens that it is those who are a bit aged that you discover them having issues like this.
Yes.
But this time around, actually noticed it in younger ones. Why has this changed over time?
Yeah, so basically, I believe that a lot of things have changed when it comes to medicine as regards to age and certain diseases. Of recent, I can't count how many people who are within the ages of 28 and 32 in the past few months who have seen newly diagnosed with hypertension. This is something that we taught as well, that it was usually for the older people. And while I would say very important that genetics has a very high role to play, family history, having a family history, someone in your family who has had stroke, who has had hypertension, who has had diabetes, increases your risk of getting it. But now with the younger ones, because of our environment, because of the things that have changed with diet, the things we eat, the kind of stress levels that we are currently working on, you see someone as age of 30, trying to hustle and get money for family and all that, there's now stress involved. So environmental factors on the genetic factors makes it worse for certain people, in the sense that they get to start showing symptoms at an early age. Most people who are younger and have stroke, usually it's as a result of hypertension, and this is from hypertension. When you go somewhere, maybe they're doing something, or a health walk somewhere or something, and you check your blood pressure and they say your blood pressure is high, and you're like, I'm just 29, that's not possible. And then you just neglect it. I didn't sleep, that's why, instead of going to the hospital to have a follow-up and get checked and stuff. And so after you have stayed with blood pressure uncontrolled for a certain time, and then there are factors in your life which are worsening this hypertension, at a point, there's going to be a point where it then progresses to having symptoms like stroke, because, as I mentioned earlier today, that having hypertension, for uncontrolled hypertension actually, for a long period of time, can predispose you to having certain strokes. Basically, certain vessels in your brain will just pop. And because higher detention is just normal science, detention increases, there is aneurysm, and then there is breakage. And so because of that, you see a lot of young people who are coming down with this stroke, and they're wondering, this is something my father had at 70 something, this is something my mother had at 80 something. But because we are neglecting our own health, and then there are environmental factors like what we eat, how we're living our lives, the stress involved, basically these environmental factors have worsened the genetic factors that a lot of people have already. Most people in the world today, their parents have stroke, and once your parents have stroke, or have hypertension, because hypertension is more common in parents, or have diabetes, you are at higher risk of getting these diseases, and then that predisposes you to even getting other diseases and other extreme cases like stroke.
That's very critical, and just like we normally do say that everything you do, you have to check it, and this is just one aspect of it, so that you won't be caught up without actually preparing for it. But yes, how can communities or workplace promote a lifestyle that is both active and stroke conscious?
Oh, that's good. I also believe in incorporating this in workplaces. I would admonish a lot of workplaces to actually incorporate a system where their staffs are being active, because most places there's just a sitting kind of thing. You can create activities for your staff members once a week, once a month, whatever it may look like. I would recommend once a week, where there is maybe something regarding to health. A lot of places, especially in this part of the world, they do like a health check for their staffs, which is good. But there should be events to actually prevent it in the first place, because these health checks is just checking, is there sugar, is there hypertension? If there is, you go to the hospital. But you can incorporate activities like exercise, jogging, taking runs, and these activities as well create bonds between staff members. This is a way of creating so for example, if at cardio care, let me use for example, there's something we do health walk, like sometimes twice a month, but at least every month there is usually a health walk we do, where people come out, jog, walk, dance, just being active. This is just a way to not just encourage our staff but also our patients that this is what you should be doing. And I believe in every sector they can look for ways to incorporate this. I know a couple of facilities that what they do maybe on Saturdays, places that don't open on Saturdays, they just create kind of like an event for their staff to help with bonding, but also to help with exercises. They go to like parks and kind of jog, or like do some exercises, some stretching here and there, speak to each other. And these are ways for certain places to put in activities to help prevent stroke in your staff members, especially if you have staffs who are elderly. I believe that this is something that should be part of your curriculum based on staff wellness.
Okay, that's very good. And then earlier on, before you answered this particular question, you raised issues of lifestyle and the rest of it like that. Looking at our current economic situation, do you see an increase in number of people having stroke, or a decrease?
There's an increase, definitely. Currently in Nigeria, statistics in Nigeria is very poor.
Yeah.
But about 100,000 Nigerians, about 100,000 get stroke every year. And it's definitely going to increase, because with the economic situation, people, it's expensive to eat healthy actually. If you're eating poorly, you can spend more on that. By the time you want to eat more proteins and you want to eat more vegetables, those things are more expensive in the market. And with the economic situations in Nigeria currently, it's very difficult for people to be able to say, I want to go and sign up at a gym. I want to get, everybody's usually going for what's cheaper. And that's why most of the times when I was talking about, exercise, I was saying things that would basically you could do outside, which is free to walk outside. No one is going to hold you to walk outside. And then eating, I know that's difficult, but to be honest, with the way we're going economically, the percentage of people who are stroke here in Nigeria is going to increase. And then apart from diet and exercise, even stress, a lot of us, people are taking up 3 jobs, 4 jobs a day, and not getting good sleep. At night you're wondering, what will my family eat tomorrow? The idea of, I don't know what tomorrow may look like. And then stress would also increase your probability of having stroke, because it increases your blood pressure. And then so I believe that except there is there is something that is going to be done in the long run to reduce our economic hardship and basically to ensure better standard of living. If there is nothing that is done towards this, the percentage of people who have stroke will definitely increase. And the funny part and the most painful thing is that, because actually not funny, the most painful part of it, it's going to be more towards the low income, the low economic status people, because these are the people that are not able to access that high quality healthcare, or these are the people also who are actually more affected by our economic situation. The saying, the poor getting poorer, the rich getting richer.
Indeed, that's a very good caption. And with that respect, looking at your facility now, how do you now help these people who actually don't even have much to cater for themselves when they have this condition?
Yeah, so at the facility, that's cardio care, first and foremost, we practice what we call equal health care for everyone. So we believe that everyone deserves medical health care, regardless of whether you can afford it or not. And so because of that, we make sure that our emergency is open to anybody and everybody. So although, you know, certain people might not be able to afford continuous care, but the emergent care that you need, urgent care you need, when you come in with certain conditions, especially with stroke, when we know that time is of essence, whether you can afford it or not is the least of our problems. You know, our focus then is how can we help you at this time. Emergently, how can we help you? If we can help you achieve and treat you emergently, the medications and the treatment you need urgently, and then going forward we can then refer you to somewhere you can afford care in the long run. But the emergent care, it's, you know, is something we do at Cardio Care for every and anybody, regardless of your economic or financial status.
Okay, what advice do you have for individual with existing cardiovascular issues who want to take part in a greater stroke day, something like this? This particular day set aside by United Nations.
Okay, so basically you're asking about how we can these people who already have stroke, how they can be a part of this day. So you know, a lot of people would think that when a person has stroke, the person has become disabled, and that's not the case in a lot of cases. I've seen people who had stroke, and in 1 year they've regained their normal function again. So I would, first of all, I would recommend creating awareness. They should be able to talk to people around them, you know, about what they've gone through, and that's why I like support groups a lot, because I believe that a person who has gone through the stages of their stroke journey, basically gone from having stroke to managing and then has gotten better, can tell someone who just had stroke a few weeks ago that, you know, this is the situation, this is how I went through. When they have questions, you can be able to answer. So something I would recommend, especially in stroke days like this, is speak up. You know, tell other people how your journey was, how you went through it, and then in days like, apart from speaking up and letting people know about this, I would also recommend that, you know, frequent checkups. Most people, when they get better, especially people who have had stroke, or even people who have had any long-term disease, they feel like, okay, I'm better now, and then they start walking away from the hospital or not coming to their checkups as they should. But funny enough is that if you've had stroke before, you have a higher chance of having stroke again. Wow. So a history of stroke doesn't mean that you can't have stroke again. I've met patients who have had 4 times stroke. They've had stroke affecting different areas of the brain the 4 times. So continue going for your hospital checkups, frequent hospital checkup, create support groups, speak to other people, you know, speak to your family members. You know, a lot of people today, they have a bias about stroke and think of stroke a certain way, especially amongst us. Sometimes it could be traditional and local. Once you have stroke, they just put you on a bed in a room and think that you're going to die now. People come out of stroke. So creating awareness, speaking to our loved ones about it, and continued medical checkup is what I would recommend.
Thank you so much, Dr. Hada Ume, for joining us today on the afternoon edition. It's nice having you. But when you said, when I was told your name is Ume, I said, oh, is it the Ume, the former governor? But then fine, it's nice having you on the program, the afternoon edition. Always a delight.
Thank you very much.
So this is how far we can go today on the afternoon edition, discussing with Dr. Hada Ume, a cardiologist with the Cardio Care Hospital, specialty hospital here in the FCT. And she has said so much on this particular day. The United Nations set aside to actually create this now in the hand. She has done justice to that. My name is Isanu Habu.